Hello and welcome. I'm your host, Neil Howard, here on Health Professional Radio, and I'm real glad that you could join us again. In this segment, we're going to be speaking with Pascale Leroueil. She's joining us here as Vice President of Healthcare at the William Davidson Institute at the University of Michigan to discuss a recent study where she and co-authors presented a method for estimating the impact of vaccine technologies on vaccine coverage rates. Welcome to Health Professional Radio, Pascale. Thank you so much for taking the time with us this evening.
Thank you so much.
What is your area of expertise?
So my background, I'm a scientist by training. So I did my PhD in physical chemistry, and I spent about 5 years working as an academic scientist in vaccine adjuvant development. And I decided to leave academic science to go more towards the business side of research. So about 6 years ago, and an MBA later, I ended up joining WDI, where I now lead a small team of researchers and consultants working in the healthcare space and specifically in emerging markets, so low and middle income countries.
This study that we're going to discuss, what was the purpose of the study? Give us a little bit of insight into the study design, and why is it important to be able to estimate the impact of vaccine technologies on coverage rates?
Yeah, so we had been asked by a very large global health donor to help them think about the relationship between a given vaccine presentation and its associated vaccination coverage rate. The reason for this was that the donor was interested in making better informed decisions about how they invested in new vaccines, as well as how they thought about their investments in vaccine manufacturers. And so the paper that we're talking about right now presents that approach for estimating what a vaccine coverage in a given country would be if you were to deploy a vaccine with certain characteristics, i.e. a given vaccine presentation.
Mm-hmm. When you're talking about vaccine coverage, are we talking overall population, or are we talking specific parts of that population?
Yeah, so we tend to work in low and middle income countries. And so when we talk about vaccines, we're usually talking about vaccines meant for children. Mm-hmm. So you're 6 months to 10 years old, for example. But there's nothing about this approach that we've used that is specific to that target market. It's just, it happens to be usually used without that group of people.
What about the study design? How did you go about getting your results?
So for the first thing that we had to do is that we had to develop an approach that we thought was simple and transparent to answer questions that there really is not great data for. And so what we did is we started with a basic assumption that vaccination coverage rates are a function of two things. First, barriers to vaccination in a given environment, so potentially a country. And second, the characteristics of the vaccine presentation that's being deployed in that environment. And so we ended up defining a number of barriers, in our case 6, that in principle could be defined or could in principle be addressed by some type of change in the vaccine presentation. So, for example, one barrier in a country might be lack of dependable refrigeration. That barrier could be overcome if you had a vaccine that didn't require refrigeration. Mm. And from there, we then had to think about how we turn that idea into numbers that would allow us to say something to the effect of, if country X had vaccine presentation of Y, this could achieve a vaccination coverage of Z.
Is the ultimate goal to be able to design vaccines that are basically cover-all? They don't need refrigeration, this, that, or the other. Is that the ultimate goal?
So that would be an ideal situation. Mm-hmm. So if you could develop a perfect vaccine, it would be a one-dose vaccine that requires no refrigeration, that could be administered by yourself, for example. That would be what we might define as that perfect vaccine. But in reality, there are trade-offs. So sometimes there are trade-offs. And what we want to do is identify what a vaccine presentation might look like that gets the best coverage we can for the buck. Because there's limitations in time and limitations in investments so this approach then says, okay, if we had something that looked like this, some characteristics, we could get coverage at 85%, which is pretty good. It's not 100%, but it's pretty good. Mm-hmm. And so that allows you to think about quantitatively what are the trade-offs that we might be able to make if we were to swap out or to improve different characteristics of the product.
Did you find that there were any barriers that were consistent no matter what region that you were considering?
So we had defined 6 barriers, mm-hmm. and 6 barriers, and those barriers had to do with, the administration requirements, number of doses required, temperature requirements. And they, in large part, had been developed for us by WHO had participated in helping define those barriers. But interestingly, we thought that they actually were consistent across all countries. The difference was, what is the magnitude of that problem in one country versus a different country? That specific barrier may be more critical in one country versus another country. Take, for example, dose requirements. That's a barrier. A vaccine requires multiple doses. That tends to reduce coverage. But in the U.S., it's the same thing. It can be a barrier to vaccination by requiring that child to come back to the clinic. It's a lower barrier for the U.S. in most cases than in many of the countries that we work in, but it is a barrier nonetheless.
How has the COVID-19 pandemic offered challenges or opportunities for your study? What did you find out based on the pandemic's effect?
Yeah, I think it highlights. So, I mean, there are two things if you think about the vaccines for COVID that popped up over and over. One was the number of doses. So you had differences between the one vaccine, a one-dose vaccine and a two-dose vaccine. And the second was temperature requirements. For us, when we were seeing what was happening, it was predictable. It's just even based on our little model of course, refrigeration is going to be a barrier. And we're seeing that play out in a lot of the LMIC countries that we're working in. Their vaccination rates remain low in large part because of what we would call technical barriers that could be addressed if the vaccine had certain characteristics, ideal or better characteristics.
So as far as the projected demand for certain vaccines in certain areas, being able to pinpoint that demand and accommodate that with coverage, that's the ultimate goal, especially for the shareholders, right? For the stakeholders. Exactly.
So if you could tell a developer and someone in R&D or someone who's manufacturing vaccines, look, if you could develop a vaccine that has these characteristics, we think your potential demand is going to be X. That type of information is extremely valuable, it's valuable certainly to the public sector, but it's also very valuable to the private sector who are developing these vaccines and who are manufacturing these vaccines.
Speak to the efficiency as far as the study results when it comes to developing these vaccines. Are we talking billions of dollars in savings for manufacturers at the same time taking care of the vaccine experience for the patients?
So I can't speak to the expected savings, but I can say that, that's the hope is that we're going to save people money. We're going to save people money and time, both the patients as well as the manufacturers, because ideally this information will provide information that will guide decision making in a way that avoids maybe putting too much energy trying to decrease the number of doses that a vaccine requires. What if 3 doses is fine and you'll get the same coverage? It's really trying to help guide efforts and investments in vaccines.
Obviously, there's a lot of trial and error in some of the decision making without this correlation between the supply and demand of these vaccines.
Absolutely. And I think, and I don't want to overstate what we're doing, because this information that we are able to generate with our approach is something that should be used in conjunction with other pieces of data, other information. But it's certainly an added piece of information that we believe is useful to helping these decisions, this decision-making process.
Well, is there a website where we can learn more?
There is. There's a publicly available paper that we're happy to share with you. That's on PLOS One, the journal PLOS One, that we're more than happy to provide a link to. That it's publicly available to anyone who's interested, and you can actually even download the we call it the approach or model. It's an Excel file basically that would allow you to run these studies yourself.
Great. Pascale, I appreciate you joining us here on Health Professional Radio this evening. Thank you so much for your time.
Thank you so much. Bye-bye.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Pascale Leroueil. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.